尊敬的各位领导、各位来宾、女士们、先生们，大家早上好！很荣幸来香港参加乐龄科技博览暨高峰会，这也是4年来第一次来香港参加这样的一个大型活动，感觉非常开心。我的英语和粤语都很普通，这个普通话也很普通，所以也请大家包涵。用户为本，科技向善是腾讯的。用户为本，科技向善是腾讯的愿景和使命。我们致力于将社会责任融入到产品和服务中，以用户价值为依归，推动科技创新和文化传承，助力各行各业升级，促进社会的可持续发展。腾讯一直认为科技是一种能力，向善是一种选择。因此，2021年4月，腾讯进行了第4次战略升级，在用户为本、科技向善的愿景使命的基础上，将推动可持续社会价值创新作为公司新的战略基座，形成了扎根消费互联网、拥抱产业互联网、推动可持续社会价值创新的新的战略。腾讯的服务对象也从传统的 to C 面向用户，比如大家熟悉的早年的 QQ， 现在的微信 WeChat， 发展到 to B， 包括产业和这个政府、腾讯云、物联网、大数据等业务。现在又增加了 to S， 面向社会。按照腾讯公司董事会主席马化腾先生的话，用户、产业和社会 CBS 是3位一体的，但最终指向的根基是为社会创造创新价值。为保证腾讯战略的落地，腾讯一方面宣布了2个500亿的资源投入，另一方面在公司企业社会责任部和腾讯基金会的基础上，成立了可持续社会价值事业部，为科技向善的愿景使命投入了更强大的组织保障。腾讯 SSV 以让善意生长出更多的可能为使命，将自身定位为科技助力社会公益的探索者，主要承担2个重要责任：一方面，推动公司各产品和业务拥抱社会价值创新；另一方面，通过成立银发科技等实验室，在民生和发展领域下场去探索和实践科技如何助力社会公益和社会发展。当前，人口老龄化已经成为全球共同面临的社会问题和挑战。中国的人口老龄化面临着老龄人口规模大、速度快、未富先老、养老护理人员严重不足等经济和社会的挑战。预计我国2035年左右将进入重度老龄化社会，可能我们的香港地区现在已经进入了这个重度老龄化社会，但是中国其他地区要到2035年进入重度老龄化社会。这也意味着我国新的100年发展目标，同时也叠加着人口迈向重度老龄化这样的一个社会挑战。在这样的大背景下，积极应对人口老龄化已经成为了国家战略。党和政府在推动积极老化、健康老化的老龄观，正在探索走一条中国特色应对人口老龄化的道路。在国家和社会面临着人口老龄化的巨大社会挑战下，腾讯 SSV 设立银发科技实验室，是想探索腾讯这样的一个科技企业如何从传统的公益捐赠及企业社会责任进行升级，利用腾讯的人工智能等科技和数字化能力，以创新的方式探索科技普惠规模化的这个可持续解决方案，助力国家和社会应对老龄化的重大挑战。银发科技实验室成立以后，目前主要聚焦在用科技助力老人守护3大健康：身体健康、心智健康、财产健康，以减少老年人的失能、失智和失财的风险。 我们知道，老年人面临的重大健康威胁之一就是摔倒。我国每年有4000到6000万老人摔倒，摔倒已经成为65岁以上老年人伤残失能、伤害死亡的第一风险要素。特别是我国空巢老年人占比超过了50%，独居老人一旦发生跌倒和意外，会导致老人无人救助和救助延迟，而错过最佳救助时间。因此，我们整合腾讯的 AR、云和物联网等核心技术，针对老人摔倒的场景 ，AR 工程师成为试摔官，一次一次去模拟老人摔倒的体态，打磨和优化算法，发布以老年人跌倒检测为核心的 AR 守护产品“隐形护理员”，并在去年进一步整合了腾讯会议天籁实验室的 AR 语音能力，实现了呼救词检测和 AR 语音的双向通话功能。经过3年多的迭代升级，跌倒和呼救词 AR 检测的识别准确率已经超过了90%以上。因此，今年5月，我们联合国内安防领域的龙头企业大华一起共创，将腾讯的 AR 跌倒告警的这个算法整合到大华的摄像头中，推出了普惠、规模化的隐形护理员摄像头版，通过视频加语音双模式的 AR 能力，帮助老年人、子女和养老护理员更好地守护老人的生命健康。我们还发布了隐形护理员的移动版产品“银龄守护卡”。银龄守护卡是银发科技实验室联合深圳吉米物联一起共创的一款老人安全定位、紧急呼救的科技助老产品。这款产品和公卡差不多大小，便于老人随身携带，将对老人的安全守护从居家延伸到社区以及外部的社会活动场景。它一方面能够作为简单的老人智能机，具有微信扫码支付、滴滴打车、双向通话等老人常用的功能，同时也有双重定位、一键呼救、安全守护、报警等功能。对于失智症老人发生走失风险时，还可以通过定位轨迹还原等功能顺利找到老人。某种情况下，它就是咱们香港地区用了可能有10多年的平安钟的一个智能科技的一个版本。由银龄守护卡、隐形护理员以及居家和外出2个场景构成的智能安全守护产品，辅以我们和腾讯微保一起共创的跌倒守护的公益保险，那么组成了银发安全守护的一个整体解决方案。我们又进一步的提出了4级响应机制，通过科技助老产品的后台，分别连接子女和护工、老人所在的社区和街道、民政部门、120医疗救护系统，在老人有任何安全或者紧急情况时，将依次发出告警信息，直到老人救助信息得到响应，这样建立了科技助老产品加养老服务的一个守护闭环。今年5月21号，在民政部的指导下，腾讯和中国老龄事业发展基金会等合作伙伴一起发布了银发共同守护计划，面向全国范围的2万名高龄、独居、空巢老人，通过公益捐赠的方式，联合政府机构、公益组织和生态合作伙伴，共筑老年人安全守护的生态圈，用科技产品的连接能力，联动5社的力量和子女、政府和医疗机构等一起守护并救助老人。今年7月，银发共同守护计划率先在广东佛山市南海区开展试点，在南海区民政支持下，在试点社区为老人捐赠配发了银龄守护卡，搭建了首个连接政府、社区与子女的老人守护网络。截至目前，已经有超过900位老人配发了银龄守护卡，并成功救助了4名突发意外的空巢老人。未来，我们将联合南海区民政，在3年内，在256个社区幸福养老院落地以银龄守护卡为核心的科技助老产品，用科技产品的连接能力，号召更多的社会力量，包括兴业青年、社工机构、 以及政府等，全方位共同守护空巢老年人的安全生活和安全和生活品质。听力障碍是老年人面临的另一个健康威胁。世界卫生组织的数据显示，全球1/3 65岁以上的老年人存在着中度和中度以上的听力损失。老人因为听力障碍减少了社会参与，也成为了老年失智症最重要的发病因素，也会导致老人摔倒及引发精神抑郁。数据显示，我国65岁以上有听力障碍的老人大约有1.2亿，需要助听器干预的老人超过了6000万。从国际上来看，通过佩戴助听器进行听力健康干预是避免听力不断恶化的一个最重要的干预手段。但实际上，我国佩戴助听器的老人只有400万左右，不到6%，而在英国，它已经接近了50%。银发科技实验室就老人听障这个社会问题进行了系统的梳理和调研，针对老年人听力自查率低、听力科普知识匮乏以及优质助听器价格高昂等导致我国听障老人的助听器佩戴率低等原因，与内外部合作伙伴一起共创，推出了针对老人听力健康系统化的整合式的解决方案——银发听力健康小程序加腾讯天籁 Inside 的助听器以及听力健康第三服务网络，从而帮助更多老年人应对听力损失问题。银发听力健康是国内首个集成听力筛查、听力科普以及听力模拟为一体化的小程序，由腾讯会议天籁实验室、腾讯一点、北京听力协会等内外部合作伙伴一起共创，包含了听觉能力评估和听力健康科普2大板块。听觉能力评估为老人提供了多种场景下的在线听力测试工具，听力模拟器则打造了让听力正常的用户可以切身感知听障老人的听觉世界。银发科技实验室还联合腾讯会议的天籁实验室一起，携手助听器厂商智听科技一起推出了智听腾讯天籁 Inside 助听器，把腾讯天籁 AR 的算法能力赋能给共创合作伙伴智听。基于在实时音频领域多年的积累，天籁自研的 AR 算法能够帮助国产助听器厂商将复杂场景下语音的清晰度和可懂度提升了85%，让1000元级的国产助听器也能媲美万元进口的助听器的性能。我们还和北京听力协会和中国计量科学研究院一起合作，对银发听力健康小程序进行了专业的校准和测试验证，让小程序的测听效果能媲美专业的听力计，从而保证数字化听力筛查的质量和准确度。针对老人无法接触到线下听力验配资源和服务的问题，银发科技实验室联合地方政府、行业合作伙伴和慈善机构，探索搭建了城市和乡村听力健康的第三服务网络，提供听力筛查、结果讲解、分级导诊、助听器验配、跟踪随访等听力健康服务，发挥数字化工具高效便捷的特点，更快、更广泛地帮助到老年人，让听力筛查、验配、康复能够就像佩戴验配眼镜一样简单。同时，银发科技实验室也正在和腾讯会议天籁实验室一起，和国产助听器头部厂商共创，通过开放 AR 的算法和能力，去赋能更多国产助听器厂商，从而能够推出更多普惠的国产助听器。我们都知道，随着人口老龄化，以阿尔兹海默症为主的老年痴呆病的发病人数持续增加，严重威胁了老年人的健康和生命质量，给家庭和社会带来了沉重的负担。认知障碍中占比比较高的阿尔兹海默症是一种和年龄正相关，但病理机制至今还不太清楚的疾病。 65岁以上的老人通常有5%左右的发病率，那每过10年会增加5%，80多岁的老人可能有25%以上的这个失智症发病率，这是老龄化社会非常严重的一个社会问题。目前全球阿尔兹海默症的患者已经超过了5000万人，预计到2050年将翻倍。中国确诊的失智症约有1500万人，如果加上处于 MCR 阶段，也就是说轻度认知障碍的老年人，那将是一个非常庞大的，超过了4000万的这样的一个人群。那么在中国，我们发现对于认知症来讲，存在着宣传不足、筛查不足、干预不足以及跟踪不足等社会问题。那我们都知道，科学界的共识是大脑有一定的认知储备能力，如果能在早期的 MCR 阶段就有意识地对老人进行干预，可以延缓7到10年进入失智阶段。对于80岁以上的老人，如果延缓7到10年，可能就会到死亡之前都不一定能够进入发病阶段。这也就意味着，对于 MCR 阶段的认知症进行早期的筛查和干预，具有巨大的社会价值，会极大的降低社会疾病负担。从国际大量的实验来看，通过游戏、运动和饮食对于 MCR 阶段老人进行干预是有效果的。从2022年开始，腾讯也在做一些探索。我们希望通过数字化和功能性游戏等方式，进行认知症的科普教育、早期筛查和数字化干预。今年10月，我们联合腾讯游戏社会价值中心发布了认知症科普游戏6动301，让大家能够在游戏中体验认知症的世界。同时，我们还发布了银发脑动力小程序，利用 AI 和数字化进行这个认知症的早期筛查。未来我们还将发布脑力智趣帮功能游戏，这是用游戏的设计理念、交互手法制作的，用于轻度认知障碍训练的功能性程序。我们希望老人通过这样的一个小程序，能够定期进行锻炼认知能力，减缓认知衰退。腾讯响应国家老年痴呆症防治行动和中国老龄事业发展基金会、北京6院等合作伙伴，一同发起了老年认知障碍防治促进计划公益项目，以数字化工具为老年痴呆症等认知障碍的防治提供创新的解决模式。我们希望通过数字化、网络化的创新工具，线上和线下结合，以社区为重点，探索老年痴呆症的防治创新模式，包括以数字化、短视频等形式开展老年痴呆症的宣传教育，利用数字化工具以社区为基地，开展认知功能的筛查和早期干预，实现早筛查、早发现、早干预，减少和延缓老年痴呆症的发生。通过严肃游戏，提高老年人群参加认知障碍干预和学习的积极性和依从性，利用人工智能等技术探索利用生物标识物等方式来早期筛查轻度认知障碍，降低筛查门槛，加快筛查速度，提高社区老年人痴呆防治的效率。腾讯银发科技实验室的相关产品已经在多种场景中应用，也获得了政府和社会的多种荣誉和认可。我国应对老龄化的中长期发展规划中提出，科技要成为积极应对老龄化的支撑力量。我们一直致力于通过合作伙伴共创科技助老产品的方式，让科技创新能成为应对人口老龄化的第一动力和战略支撑。经过3年的探索，我们逐渐形成了联合内外部合作伙伴，以老年人面临的痛点问题为切入点，以共识、共创、共享、共益为核心理念，多元主体共同参与的科技助老生态，以产品的市场化、规模化应用为目标的共创方法论和生态创新模式。也希望借此机会能和粤港澳更多的合作伙伴一起共创，让更多的高龄老人 能够享受到智慧养老的服务，享受到科技创新带来的养老便利。谢谢大家。
Very good morning to everyone. It's my pleasure to be invited to attend this event. Actually, a few years ago, I've been noticing this event, and I can't believe today I'm standing on stage to share what I'm doing in the space of Gerontechnology. Thank you to the organizer for inviting me. Yeah, I will spend the next 20 minutes to talk about the difference between lifespan and health span, and then I'll talk a little bit about digital health. And I'm not sure how much you know about Malaysia. It's just a little bit of introduction about the overview of aging landscape in Malaysia and what the government did and what Monash have done, both including Monash Australia and also Monash Malaysia. Now, I first would like to share a story. My first story is about my amazing great-grandma-in-law. So her name is Li Chiao Wai Tai Po. I call her Wai Tai Po. She actually have that San Chun Jing Lian, the very small feet, and she always smile. She passed away at the age of 107, and at that time we have 5 generations attending the funeral. It was a red funeral where everyone wore in red. And I truly have seen someone have lived such long life and healthy life. Basically, she just passed away in the sleep. The second story that I want to share with you is my amazing father. So this is the photo where they took in Japan during the Sakura time. That was in 2018. And then this is the photo where he carried my twins, one boy, one girl, back then in 2018. He actually retired at the age of 56, okay, but he transformed his life to be a very caring father and also grandfather, providing high quality childcare to my children. And something happened after that where he fell sick. Basically, he got colon cancer, and then he stayed in a hospital for 1 year, okay? And during that difficult time, my sisters and my mother have been caring for him, and when he recovered, he started to embrace technology. He used the My Sejahtera app to go to hospital because basically he still have to go to the hospital every day when he discharged home. And then because we can't afford to ferry him to the hospital every day, and that's why we taught him how to use Grab. In Malaysia, it's like the little Uber. So he used Grab, and then we also learned a little bit of the nursing stuff, like, because basically he carried a stoma, and then he lived for a couple of years. So sadly, he passed away in February this year, but me and my family, we kind of reaped the deep value of caregiving for my dad. So I share you this story just to let you see, the difference between lifespan and health span. And of course, we want to live a longer health span, and there's a lot of opportunities, in this longevity economy. So if you look at trees, right, this is a photo where I took in Alishan in Taiwan. I had the opportunity to give a talk in Taiwan in a medical design conference, and I actually realized that a lot of people actually look at this economy as a tree, all right? If you look at a tree, there's branches, there are, twigs, but people always lump that category, people above 60 years old, as a tree. But we should see, there are different stages of life. People can use basic technology, can use advanced technology, and that's where the market have to reset our language to talk about, when you sell product services for longevity market. I think one example you probably have known is the Nike shoe, all right? The Nike co-founder, Phil Knight, is, jogger. And as he aged, his designer, Tinker Hatfield, designed a shoe called Crush One, and they promote as for athlete forever instead of older athlete. So they have reaped that consumer, because the 10% of the consumer are actually seniors, and this is the way they market their product for the athlete forever. Now, the basic definition of digital health is just the field of knowledge and practice that links to the digital technology to improve health, right? This is the definition of WHO. And recently, they have looked into this definition and have made a few amendments, all right? Starting from 2020, they have came out with Global Digital Health Strategy. Up to 2023, they have kind of reclassified that digital health intervention. And if you look at the digital health deal shares, it has been increasing, particularly in Asia. And also care delivery and navigation tech has been also popular, increasing. Now, if you like oysters, all right, and if you have visited the farm, you will see oyster is just like tons of data, but only 1 in 10,000 wild oysters will yield a pearl. And this pearl is actually the insight, which is what we are trying to understand, and how can we transition from data to insights, right? So there are different types of data, right? We have genomics data, we have the community health workers' interaction with patients data, especially in Hong Kong. Your social service is really top-notch, and you have a lot of data. You could utilize the data, and we also have a lot of wearable data, pharmacy data, and also your doctors' clinics data. So in the past, we talk about digital health, but the language now is talking about digital in health. So if you look at the bottom, digitalization, when we talk about to digitize the data, like making the hard copies to soft copy, is more with the aim of improving the efficiency. And the next steps is digital for health, is looking at effectiveness, how we could leverage the data to improve the health systems, processes, administrations. But now we're talking about digital in health as to look at digital as a business enabler, all right? Now we want to use to transform from providers, medical records, to patient engagement and patient empowerment, and to become more personal and patient-focused. And we don't want to look at technology as a technology per se, but more so to focus the problem that what we are going to solve. And of course, those days, we don't talk about generative AI, but now we can actually integrate AI in that services as well. So that is the digital in health in the future. So what the Malaysian government did, this is our current population. I know that some of you may say that, compared to China and Hong Kong, this is not a big number, but for us, it's a big number. In fact, World Bank have done a study. The age of aging rate for us is almost similar as Japan in the next 24 years. So currently we have, about 11.3% of us are 60 years and above. And then in the 90s, we started to have this national policy for elderly, but that was actually more focusing on social status and well-being. That was under the Ministry of Women, Family and Community Development. It's a very small part of the ministry. That's why nothing has been done a lot to actually look into this factor. And you can see more than 10 years later, after they introduced that policy, they then launched the National Health Policy for Older Person, focusing more on health promoting and disease prevention activities and to support independent living. And then 2011, they came up with this National Policy for Older Persons and Plan of Actions for Older Person. From there, they want to develop a caring society to improve the capacity building and also to address the safety and social security of seniors. From 2021 to 2025, the government have decided to look into post-hospitalization care and also to promote this harmonious environment. That's where we have either on the park, the retirement living. You can see a lot of retirement living developers are starting to build their projects in both West Malaysia and East Malaysia. Now, recently, World Bank is working with our ministry to come out with this national blueprint called Aging Nation Blueprint. And they realized that aging issue in Malaysia is not just healthcare, but is the post-retirement employment. Because of COVID, during the COVID time, the government allowed people to withdraw their savings because they lost their job and stuff like that. And now, after post-COVID, they found that the average saving in Malaysian, among Malaysians, is really low, and they are a bit worried where, how to assist and try to reduce this aging poverty. So the key issue is, again, health span that we want to talk about. And they have identified, they also need to look into NCDs and health risks and also some other issues related to old age like dementia, palliative care, and mental health. I'm also very glad that panels before that talk about mental health. This is really a key issue among the seniors. Now, the key policy direction here is still promoting healthy longevity, okay, to reduce the health risks and also to connect healthcare and long-term care, and also to look at this old age problem. But more so, they have looked into the employment side, all right? They would like to maximize labor force participation and to allow people to work longer. The official retirement age for Malaysian is 60 years old, so meaning that when you hit 60, you have to retire. My father actually retired at the age of 56. That time, at his time, is 55, and you can extend for 1 more year to continue. So we have Higher Senior. It's a company. Currently, we're working with them as well. They actually launched this platform to connect employer and potential employees. They also partner with Khazanah. Okay, Khazanah is one of the three-party entity under the Ministry of Finance in Malaysia. They actually got some funds to launch the MyStep program 2021 to 2022 to get seniors who have already retired and work in the company for 6 months. And then the host company reserved the right to rather hire them. So in this program, they have generated 70 million per annum for this. So that was the high-level part. But within the university, at my capacity, I also enable people to work and learn. I actually have a student, 69 years old. Mr. Kok is doing a PhD on bridge employment with me. And I also recently hired Dr. So. He retired from a public university, and he now is a senior lecturer in my department. And I also hired Madam Fu, 65 years old, as a research assistant working in the lab. And this is where we can actually understand, the challenge and the need and the support dealing with older workers as well. So what Monash have done, in the past few years, Monash have moved away from focusing on high-quality publication to societal impact. So we have these 3 key areas under the Impact 2030, climate change, geopolitical security, and also thriving community. So the whole system, promotion systems, has been tailored to making an impact in the society. Just a snapshot of Monash community. So Monash, we are the G8 in Australia. The main campus is still in Melbourne, but we have a full-fledged campus in Malaysia. We started back then in 1998. This is our 25 years anniversary. And we also started a campus in Indonesia, 2021, and then we have our footprint in India, Italy, and also in Suzhou, China. So as I said, we've moved from scholarly impact to societal impact, encouraging our academics and students to work towards making an impact in a society. So this is the cross-disciplinary work that I would like to highlight in Monash, Australia. There's a lab called Monash Design Health Collab, and they work with the Monash Art, Design and Architecture, with industry micro X. The green one is the industry. They come up with this mobile stroke imager that you can actually use it in the ambulance so that you can diagnose the patient, and by the time the patient reaches the hospital, they can actually know what to do, immediately, because stroke patient, the time critical is very important. And the second item, we recently got an award in Monash in Australia. It's called PALM. It's personalized aerosol loading and management. It's for the asthma patient, because this device, for the past 70 years, no one have actually innovated and redesigned it, but they have leveraged on microfluidic technology and to also incorporate climate change to reduce the carbon emissions, that this technology can also be refilled, and they also can change the casing. During the COVID time, the lab also worked with Sensi Lab, another lab in a different school, with industry Blundstone, to design booth for the healthcare worker, basically to monitor their fit activities to detect abnormalities. And after that, they have moved to focus on diabetes patient, to help them to observe the activities and to treat the symptoms associated with diabetes. And the shoe is actually distributed by Blundstone manufacturer. On the other side, for more wearable stuff, they have this group app for diabetes patient as well. They take into consideration food intake and to try to understand the glucose level, and also feedback to the user. Bill Gates has said that, when we design technology, it has to be fit into our everyday life. So that's where Monash Design Health Collab in Australia. They come up with a smart jewelry. It's a necklace, all right? And you can wear a ring where you just inject your insulin through your ring. So it's really embedded in your daily life, and it's also fashionable. And they have also invented this smart heart necklace. Okay, basically you just wear as a necklace, and then it can help you to collect your cardiac data, especially if you are someone that have, recently have heart attack, or you have experienced heart rhythm problems. That's where you can just wear this as, a fashionable item. This is under Professor Leah His. It's a hearing aid. I enjoyed the presentation of previous speaker about the hearing aid. And this is a facet. It's also an award-winning project. Basically, people do not like to wear hearing aid because it's going to, portray your social identity. But this is something fashionable as well. And it's also easy to use. Okay, small, tiny batteries. And of course, they also have other faculties to work with Monash Data Future Institute to transitions from multimodal data to create stories by cutting down the data into different layers to understand and use it in their education. Now, I want to talk about in Monash, Malaysia, what we have done. So we have this neat project, Network for Equity Through Digital Health. They have funded 6 large-scale projects. And basically is to encourage academics to look into this digital health space and make an impact in the Southeast Asia. And in Monash, we have set up the Southeast Asia Community Observatory called SECO. It's a health and demographic surveillance system in Johor. Johor is next to Singapore, but it's a more northern part of Johor. So basically, we have 5 districts in Johor, Sungai Segamat, Gemeri, Jabi, Cha'ar, and Bekok. They are tracking the local communities, not just the seniors, for 15 years. All right, so this is one of the projects on global dementia. SECO, Monash Australia, Faculty of Arts, NARI, and also ICDDR, they are from Bangladesh, to look into dementia issues and try to create new evidence based on dementia and to guide global health framework. And they also have this dementia toolkit for carer called the Talk Project. Okay, again, it's a cross-country, cross-disciplines project to come up with this dementia toolkit. And I myself is leading the Gerontechnology lab. So it's part of the Alliance for Digital Health at Monash called ADAM. So I started this lab in 2016, less than 10 years. Our aim is to do translation research, hopefully also to help to shape the public policy. But this field has evolved so fast that I have limited, with the very limited resources, we have to use the resources efficiently. So I only set 3 priorities in the research agenda in the lab. So the first priority is looking at AI and data science, and the second one is on governance and policy, and the last one is on sustainable development. So the word Gerontechnology is looking at the use of technology on the impact of 5 domains of human activities, and these are the 5 domains. So I set up the volunteer community, because in Malaysia, we have multi-languages, and then some Malay speaking, they don't really have vocabulary to explain what they feel when you interview them. So I have decided to set up this database to actually enable all the researchers and students in Monash, whoever are doing aging research, they can come to me and I can broadcast their recruitment notice to them, and they can get their participants who are able to contribute their ideas and their time in our project. So in return, I will invite them to our campus event for free and also provide them a health check every year. These are our engagement with the local communities and external. And this is one of our projects from our School of Engineering. Dr. Alpha is this emulate me on the exoskeleton. And I also work with our engineering on soft service robot. Basically, it's just to utilize some very, embodied AI to come up with this. And this is one of our first project on smart IoT. So we're using pictorial, because as you know, it's multi-language. So we don't, use language, English, Malay, or Chinese as one channel, but using picture as one of the interaction platform. This is our project on ageless. We partner with the public universities and also the private university to come up with different projects. This is one of the recruitment drive in Monash. So we go around different states in Malaysia, including East Malaysia in Sarawak, to collect data on cognitive flow and mobility. And different universities have their different research aim. One is dealing with the tools, the medical doctors looking into it. One is on microbiome. They collect their feces to study on that, and the caregiving side. And for me, I'm looking at develop the mobility technology. So this is the Take Me app that I got a small award. And mobility covers indoor and outdoor mobilities. So one of the projects I'm running in the lab is I actually get industry to loan the device from me for free. Some from Japan, some from Germany, and then we are asking some feedback from the seniors. So from this project, we managed to get some global collaborations with Davos Alzheimer's Collaborative, and also with Fingers, with Karolinska Institutes in the space, and we also do a lot of talks as well. Last year, I have the privilege to work with WHO to help them to do a study on digital health aging coach, their avatar, basically because Malaysia have multicultural, so they want to understand how Malay, Indian, and Chinese look into this technology. Monash itself is located at Sunway City. So some years ago, we have helped them to work on urban mobility project. Basically, we get the people from the residents from Sunway to come to Monash to do studies, to look at light, the spectrum of light, how they affect them, to take their blood, and then to walk around in the cities. Our project have been featured in the sustainability report. And then Sunway this year, okay, they have launched the Sunway Sanctuary. It's the new retirement living. And they also offered home health care. And of course, they have their premium medical center, okay? So the whole lodge, okay, this is where Sunway is located. We have the hotel, we have the lagoon, the theme park. Monash is next to the theme park. We have the hospitals and Sunway Sanctuary, international school, and a big shopping mall. So this is a picture where I just visited Sunway Sanctuary this October. So we're trying to establish a collaboration with Sunway Sanctuary to try to understand the people and improve the quality. So this is how Sunway Sanctuary looks like. It's very cheap. You basically just pay around Hong Kong dollar 13,000 per month, everything all in, including food. You get to live in the studio, mini theater, gym, the heated infinity pool, dining, mahjong room, library, karaoke, and all sort of stuff. It's a new project, and they also have different package where you want to check in for just one week or 3 days. Yeah. This is a project I work with the industry called Redesign at iHome, called RAL project. So basically, I want to select 3 households in Malaysia, Chinese, Indian, Malay, and to help them to modify their house based on their needs. They just pay half cost of the renovation, and the construction company will actually pay half of it. The main aim is to make into communication channel. So I will make a documentary, 6 episodes, to actually create this awareness to tell the construction company and also the service provider how you should modify the house for seniors. So for example, we should not put reflection tiles on the toilet, because when Alzheimer's patients look at them, they will thought it's their own reflections, things like that. So it's more on the communication, more on the community engagement. Recently, we have National Heart Institute, IGN, visited Monash, and we're also looking at working with them, okay? SGMC, Subang Jaya Medical Center, is just also our neighbor. They have also newly launched this Senior Connect. Basically is to give you this toolkit, and then you can take your vital sign at home, and they have the nurses to monitor your health data, and they will inform you if there's irregularities and to seek for medical attention. So from all these facilities that we have, these little things that we have, we want to come up with a Monash Digital In-Health project, connecting the service provider like Sunway Sanctuary, Sunway Home Healthcare, the hospitals, and the home clinic, and also urban community, especially in Seiko, to collect the data and look into equity in health, have this platform, and encourage more stakeholders to participate. And Monash Australia have set up Monash Action Lab. It's under the Faculty of IT. We actually have been talking, have multiple meetings to come together to put in proposal, seek for grant, and make an impact in the society. So there's a lot of things that we have learned a lot from other people. Definitely one thing we need to know is to infuse ethics and human elements in our project. We definitely do not want to move things fast and break things like social media that we all know. And I'm from the business school, so when I do project on aging, I always face challenge where the ethics community will ask me tough questions where they usually don't ask in the aging or health communities. So I feel that we should have an ethics and society review board to support the academics to do in research and also to share data as well. So I know technology is still inadequate in our society, but I high hope, and I think we'll get this thing right as long as there's ongoing efforts and communications, and we know that technology would actually enhance human diversity. With this, I end my presentation. Thank you very much.
Thank you, Professor Ted, for the inspiring sharing. Please stay and be seated on the stage for the next section. 接住落嚟，我哋會有一個簡單嘅對談環節，就住剛才2位嘉賓嘅豐富分享會再作更多嘅討論。首先，我們有請竇先生可以先到台上就座，然後我們會進行一個簡單的對談環節。而對談嘅環節，我哋好高興可以邀請到香港社會服務聯會業務總監陳文宜女士 Grace 去擔任主持人。有請 Grace。我而家就將時間交俾 Grace 啦。
係咪好緊要呢？大家嗰個心跳有冇加速啊？點解會加速呢？你會見到咧，大家咧都喺度講緊一啲自己好熱愛嘅工作。而呢個好熱愛嘅工作咧，我留多大家10零分鐘，我哋大家去探討一下，究竟我哋可唔可以參與將呢我哋熱愛嘅工作，唔單止淨係講緊大灣區，而係我哋講緊可唔可以再推前啲？喺我哋嗰個嘅亞太區裏邊去發生。我真係有心跳加速嘅，因為咧大家當聽到一啲哇，即係擺咗咁多心力落去嘅工作嘅時候，你係講緊我哋嗰個未來，唔係講緊我哋今日我哋想點。當然啦，我哋頭先聽到，雖然唔係話真係好深入咁去講一啲研究嘅項目或者係一啲嘅試點。你大約你估計得到，如果假使我哋真係去睇嘅話咧，呢啲嘅項目咧，一定係有嘢出得到嚟嘅。你唔會話懷疑佢點解出唔到嚟㗎？或者可能係咪真㗎？你唔會懷疑。但係問題一樣嘢就係我哋點樣將呢一樣嘢同我哋嗰個關聯嗱，剩翻落嚟嘅時間咧，我哋係想 focus 唔係人哋，係我哋自己，係我哋自己可以做啲乜嘢。最近咧，我咧就都幾肯定一件事咧，就係喺成個世界裏邊咧，其實嗰個轉變咧都幾大。我唔能夠講話出邊好風花火亂咁，唔同我哋無關。我哋唔可以咁講。尤其是我哋講緊，如果我哋要再推前嘅話，經濟嘅環境成個嘅動力根本上面都未揾到嘅時候，我哋仲有啲咩力去把持呢？我好肯定一樣嘢，如果假設我哋講緊大灣區又好，亞太區合作又好，我哋成件事嗰個主旋律喺邊度啊？我哋可唔可以講多啲包容啊？我哋可唔可以講啲我哋都明白嘅説話，就係取長補短？好啦，跟住落嚟呢，我就將個時間呢交俾我哋兩位嘅嘉賓。我哋兩位嘅嘉賓呢，其實呢都俾大家有一個好清楚嘅 message 㗎啦。就係其實佢哋好努力喺佢哋自己個範圍裏邊咧去做咗好多嘢。咁我先問竇先生先啦嚇，竇總。騰訊咧其實咧係好吸引人咧，係同你哋去合作嘅。呢個係一個魅力嚟嘅，一個魅力喺度嘅。但係咧，你見到咧，我哋嗰個跨界別嗰個合作咧，其實都好難打通嘅。你覺得我哋用科技，首先第一樣嘢點樣可以幫我哋聯繫起上嚟，成為咗一啲力量呢？
確實，其實科技，在這個就是全球來看，這個智慧養老和科技助老這裡，其實我們感覺和這個時代的需要還是有差距。包括我們剛才有很多嘉賓也講到日本的經驗，我們也去日本去學習和了解。那也關注到，實際上可能科技產品在這個老齡化的應用中，實際上也不是這個非常普及。所以可能伴隨着全球的這樣的一個老齡化挑戰，那如何能夠去跨越這個科技在助老這塊的應用，可能是尤其是對於中國來講是一個最大的一個挑戰，因為中國的人口足夠多，然後我們老齡化之後需要的這個照護的這個壓力，你可能我們香港地區已經大量的開始引用外勞來補充我們護工的不足，但是大陸的人口實在太大，如果說這個要引外勞的話，可能也不知道要引到多大規模才行。那我們自己理解呢，騰訊呢，因為是一個偏數字化的科技公司，所以我們最核心的能力其實是連接。你比如說這個 WeChat，微信，它連接了這個13億用戶，那當然這個以華人為核心的這樣的一個用戶群。那所以呢，我們關注老齡化這樣的一個挑戰之後呢，我們可能更主要的一個解法，就是如何把騰訊的這個數字化的能力、科技的能力和連接的這個能力，賦能給越來越多的這個合作夥伴。所以你看我們剛才分享的這些產品，其實它都不是騰訊自己的產品，是騰訊去在內部去找我們自己的相應的數字化和科技的這樣的一個能力，然後同時我們再去外部再找一個和我們一起來合作的合作夥伴，我們把我們的能力賦能給他，然後讓和他一起來針對老年人的這樣的一個問題來創造一個產品來解決這個問題。所以正如您說的，實際上我們的思考就是解決老齡的問題，我們其實並不擅長，那麼我們更擅長的是去挖掘騰訊內部的這樣的數字化和科技的能力，然後呢，我們知道我們內部有什麼，然後呢，我們再去找熟悉這個老年科技的這樣的一些企業，然後我們一起來共創，或者是甚至是3方4方一起來針對老年人的問題來進行探討解決方案。那麼我們也關注到，其實在日本也關注到，其實可能我們很多企業也不太了解老年人的需求和老年人的這樣的一個服務場景，所以呢，日本政府呢也在推動，比如說養老照護的機構、安養院和這個科技企業一起，那來共創。 所以未来我在想，就是要解决这个养老的问题，它可能确实需要更多的跨界的，那个每个人每个组织都发挥他自己的核心能力，然后针对老年人的痛点和场景，大家一起来看，我们能够共创出一个什么样的解决方案来解决老年人的这样的一个问题。所以对于我们来讲，就是我们去发挥我们的连接能力，去整合腾讯内部的数字化和科技的能力，赋能给越来越多的共创合作伙伴，一起希望能够找到这个老龄化的一些解决方案。
好，賦能，我哋今日咧所理解嘅唔係話我哋冇能力喎，搞唔掂喎。我當啊騰訊已經話佢共享到佢哋嘅能力，佢賦能俾我哋。我記得琴日咧有一位記者咧問我：喂，阿 Grace， 我哋之前喺團結香港基金裏邊嗰24個嘅痛點，即係我哋有啲乜嘢係窒礙我哋樂齡科技嘅發展嘅，而家做成點啊？咁樣樣，我好快脆。如果嗰個記者今日在場，佢都記得我好快脆我話咗俾佢聽。今天咧，我要話俾大家聽，嗰個 collaboration 嗰個協作咧係有個軌跡喺度。我唔能夠講話搞掂，我有個軌跡喺度。呢個軌跡咧係你哋一齊幫手去搭上去。頭先騰訊啊竇先生佢已經講咗，佢點樣去搭上去呢個軌跡嗰度，用公司嘅力量去搭上呢個軌跡嗰度。咁我都好想問下Professor T， 你亦都有一啲嘅軌跡咧係可以咧幫我哋去搭上去，就係你有一個好強勁嘅 testing ground， 你可唔可以講下？
唔該，我識講少少廣東話，但係我都係用英文講。So I'm from business school. So when I first started the lab, everybody asked me, why School of Business have aging? Why it's not medical school? Because we do have a medical school in Monash. But then I say we look at aging as a lifestyle. And that's where I have to get industrial collaboration, industrial grant, and then come back to the university to look for not like-minded people that have empathy level for older people surrounding them. For example, their family members, or their relative, or their neighborhood. And that's where we'll sit down together to start the conversation, what we can do in the space. So there's a lot of academics, they have the intention to publish paper, get grant. Yes, we can discuss the potential project, but that journey would not last because, you don't have that passion to drive this work. This work is really challenging because you're dealing with seniors. They have different needs and demand, and you need to understand them, and you need to tweak yourself and change yourself, and that, that hard work is not hard. The bad attitude is the hard part. So first you need to form the team, get the conversation across, stay united, and always support each other. Yeah, I believe that cross-disciplinary is very important. So my collaborator is actually from different disciplines, and we speak their language, try to understand them. And if we can't do or solve an issue, we don't give up. We can put aside, try on another stuff, and come back and look into it. Of course, there are some unhappy situations where people challenge you, but I always have this approach. Someone asks a question, I just answer the question. That's it. And after that, I will proceed to do whatever I want. So with that part, you won't have the emotion that affecting you. Is this person don't like me or whatever? Seniors may say something to you. Just treat it as they ask a question, you answer, and you give an answer. Yeah, so that's my very, very simple approach.
我可以想像到頭先大家所聽到嘅咧，就係當我哋講緊喺亞太區裏面嘅合作，我哋首先就要有一種嘅包容。但係與此同時，我哋都有目的嘅，有個目標嘅。嗰個目標係咩咧？就係我哋能唔能夠共同嗰個發展。呢個發展咧，唔單止係我自己個人去發展，而係我能唔能夠將嗰個 所謂叫做創科能夠落地，能夠係共享到嗰個成果。頭先喺嗰個嘅 PowerPoint 裏邊，我見到共享嗰個嘅成果呢一件事，大家有冇諗過自己係可以 contribute 喺個共享成果裏邊呢？嗱，呢一樣嘢呢，我好希望呢一陣間我哋完咗呢一個 section 之後呢，大家再去我哋嗰個嘅expo 嗰個嘅地方去睇嘅時候呢，唔單止淨係睇一個 product， 而係睇下究竟你見到個 product 之餘，你會唔會見到背後係有一種大家共享緊一啲咩嘅成果？我哋究竟想製造一個乜嘢嘅環境去共享呢啲嘅成果呢？呢啲係好重要。嗱，最後呢，有一個嘅領域呢，我哋都要掂到嘅。雖然我哋今日唔能夠好詳細去掂嚇，我哋頭先講咗我哋個 gap 就係其中一個部分，就係我哋有 collaboration 啦。第二個 gap 呢，我哋咧就會睇到呢，就係我哋香港係冇 testing ground，但係而家我哋亞太區我哋係有 testing ground， 香港我哋係有 testing ground。好啦，人呢方面啦，人唔係淨係講緊我哋呢一代人喎，而係講緊我哋嚟緊嗰個 younger 嘅 generation。咁我最後咧就係想將呢條問題咧俾兩位嘅，你哋覺得我哋坐喺度嘅呢班人可以點樣去聯結埋咧？我哋 younger generation， 即係我哋再係下一代我哋嘅年青人，能夠加入去我哋所講嘅樂齡科技共享成果嗰方面。好啊，竇先生你講先。
我以前那个应该是这个8年以前，我主要是关注儿童，所以关注教育。然后那个后来关注老龄的时候呢，很多人不理解，说你还很年轻呀，为什么要关注老龄化这么一个议题？那我经常说的一句话就是，关注孩子是关注祖国的人类的未来，但是关注老龄化是关注我们每一个人的未来。就是家家都有老人，我们每一个人终将去老去。所以我经常在这个，我不知道大家有没有关注到，在网上就会有很多针对老年人的攻击性的语言，然后比如说坏人变老了呀等等。我自己在反思为什么会这样呢？实际上是因为他们没办法占领互联网这样的一个以年轻人为核心的舆论场，所以老年群体在那样的一个舆论场里头，他就失声了，所以就会有针对他的更多的这个抨击性的语言。所以其实也意味着，就是如果说我们现在年轻人不为我们的未来发声，不为我们老化之后的可能会遭遇的挑战、遭遇的问题，去利用我们现在的资源、能力，一起来找到更好的解决方案，那有一天我们的父母，包括我们自己，可能都会面临一个我们没办法接受的老化的一个环境。所以呢，也是呼吁，可能更多的年轻人能够关注我们自己的未来、社会的未来，因为老龄化的这个挑战它会越来越严重，来探讨如何用科技去跨界的合作，去帮助现在和未来的自己能够有一个更好的老龄化的环境和服务的条件。
I think all of us wouldn't want to live somewhere away from your family with just a bunch of seniors together with you when you age, right? So the world that I hope we would like to live just as normal as anybody else. So I would like to build an environment where, you know, even the retirement living, you have a mix of generation, you can have the conversation together, you can enjoy the food together. It's just how we embed that. So recently I've attended an event called Khazanah Megatrend. One of the speakers is from Grab. By the way, Grab is actually from Malaysia, but they moved their HQ to Singapore. So that person came. He is the head of IT. And I asked him, would you able to enable senior at work? Because senior, a lot of them can work, but they cannot drive. Would you like to come up with some, you know, products that you can just cater for them and they just live and work as usual, as normal? And then he told me, yeah, it's a good idea. I never thought about it. Yeah, so I think all of us, even though I like to talk to business leader, enable senior at work is very important because financial security is very important. You wouldn't want to, you may have enough saving, but if you already do not earn and you want to buy a medicine or buy a technology or buy a devices, you will think twice by the time, So I feel that we really need to embrace this, and all of us can do a little bit of stuff, starting from the company, embrace them, allow them to work, accommodate them, meet their needs. And in terms of technology provider like Tencent also can do a lot in this space as well. For me, I want to build an equal world, and that's what I'm actually working towards.
好啦，咁呢個時間咧係我做一個好少嘅總結。我咧好中意喺嗰個嘅展覽場嗰度咧，去周圍同人傾偈。我都好鼓勵大家咧，去周圍同一啲咧，你或者可能有機會見到佢哋個 booth， 我明啊，我知道佢講緊乜嘢啊，你唔好咁快脆就走過，你行埋去同佢哋傾偈。琴日我好開心有2個嘅事情啦。第一個事情咧，仍然係講翻記者啦。我好感動啊！即係我每一次咧，我其實咧好喜歡咧，想知道究竟記者朋友佢點樣去睇我哋嘅展覽。佢亦都點醒咗我哋一樣嘢咧，就係原來咧喺我哋搞展覽嘅時候咧，我哋的確咧唔係一個嘅商展，而係我哋真係一個教育展覽。而呢個教育展覽唔單止淨係俾我哋講緊嘅我哋一班嘅服務用嘅使用者或者我哋長者啊、殘疾人士，而係我哋會見到嘅就係我哋講緊嗰個有魅力嘅未來咧，係要見到一班年青人。我琴日亦都有一位同事佢同我哋去分享啦，就係琴日好似都好多學校見到啲學生，我好開心嘅，因為我好開心係咩嘢咧？就係當我哋講緊養老、講緊銀髮嘅時候，我哋見到啲年青人願意去承接呢一個嘅世代。咁所以咧，對我哋嚟講咧，今日離開呢間房嘅時候，都係嗰句：再望下個場地，究竟我哋見到嘅係產業啊，還是係我哋一個有魅力嘅未來？多謝各位。
多謝3位嘉賓嘅分享。